Hello there. Let me start by saying that it's been such an awesome time over the last 4 weeks, mingling with over 27,000 participants in this massive open online course tagged Financing for Development from Billion to Trillion to Action under the platform and auspices of the World Bank Learning Institute. It's just been phenomenal, sharing ideas, learning and interacting with all that number of people. For me, what this has done is to arrest my attention and also to initiate and activate a personal commitment to participate and be a stakeholder in whatever capacity that I can to help to push the process towards attaining the 2030 development agenda or plan. Now, these will be achieved. You must understand that these will be achieved via all of us coming together to put our hands together to ensure that we achieve and attain the 17 Sustainable Development Goals, the SDGs. Of particular interest to me, for buyers, is SDG number 3, which focuses on health and well-being. Now, it's often said that a healthy nation is a wealthy nation. And so, my deepest desire for my country, Nigeria, is to see us move rapidly towards attaining universal health coverage, which means that I will be looking forward to having a nation where everybody can have cost-effective access to qualitative healthcare, regardless of their political inclinations, their social strata, economic level, or even religious inclination, as well as geographical location. And you need to understand that this happens if we are able to strategically come together and look for ways to disburse our funds in a way that will ensure that we have impactful development. Nigeria has a population estimated at 170 million. It is said that 80% of that figure reside in rural areas. It's also said that just about 7 to 9% of Nigerians have any form of health insurance or structured healthcare coverage. This means that, and that 7 to 9% is basically primarily domiciled in the urban areas. It means that there's a need for us to pay critical attention to this 80% mass of people who are exposed to financial hardship or financial insecurity in the process of accessing healthcare. And what's my solution for this? It's high time that the public sector and the private sector come together as stakeholders and find a way for us to deploy what I tag a national community-based health insurance project. How will that work? If government takes funds from development assistance, from grants, from institutional investors, or a percentage of taxes raised and direct it specifically towards providing premium for health insurance in Nigeria, it can help release or help encourage, strongly encourage or compel, by some way of legislation, the organized private sector to also voluntarily give a portion of their revenue on a yearly basis for a period of say 15 years or more. That way we'll be able to harness a pool together that we can use to deploy a community-based health insurance project across the length and breadth of Nigeria. Now, the process will be that such organizations will be required through a selection criteria to pick, select, and adopt 1, 2, 3, or even 4 communities in different parts of our country. What that does also, in my thinking, is that it will help us be able to produce a spread of more people, not just the localized concentration of communities being adopted, but even beyond the economic reach of such an organization. You'll be catering for lives and getting lives better. Our families will be better. And if truly a healthy nation makes for a wealthy nation, then that will be significant development that we will have done just by bringing stakeholders together and having another look at how we disburse our funds. My name is Aniekan Usoroh. I'm from Nigeria, and those are my thoughts on financing for development. Thank you.